Hello all, welcome to my YouTube channel TCAM Tutor. So we'll start with the first part of question paper discussion. So the first question was related with the amblyopia in children. So amblyopia means lazy eye. Okay, so that is the synonym of amblyopia. So here what is happening means in one eye they will be getting blurred vision and another eye will be in a normal vision will be there. Okay, so one you can see in the picture, one eye they will be showing blurredness and another eye will be having normal vision. So because of that, what happened, the brain will get confused and the brain will be receiving only the clear vision. The brain will be ignoring the blurred vision. Okay, if it is a right eye is having blurred vision, so the brain will be ignoring the right vision. Okay, only receiving the left vision they will be receiving. Okay, so like that of confusion will be arising. Okay, because of that confusion, what happened, brain will be receiving only the clear images. Okay, and because of that, what happened, there will be superimposition, like there is a another images will be adding on to the clear vision. Okay, so there will be superimposition of the two dissimilar images will be happen, and because of that the patient will be getting squint in one eye. Okay, and if it is not treating properly, it leads to the permanent loss of vision in left eye. That condition is called as amblyopia. Okay, so this is usually affecting the kids. Okay, so the brain will be ignoring the weaker eye, and because of that, what happened, the eye will be drifting, that position, that images, all those things will become drifting. So you will be getting, like if the children wanted to see some objects, frequently they will be doing the head tilting, squinting of one eye will be there, closing one eye. So this type of any one of the signs you can see in the children. Okay, so the causes for getting this amblyopia is due to refractive error. You can get refractive error means like a myopia, okay, hyperopia, astigmatism, then strabismus. Okay, strabismus means crossed eyes, and due to any eye condition like ptosis, cataract. Okay, so these are some of the reasons. So in all these reasons, what happened, in one of the eye you will be getting blurred vision, and through that way it will be creating amblyopia. So identify the cause for getting the amblyopia, then you have to do the treatment. So in the treatment options, if it is happening because of hyperopia, myopia, then you will be putting eye drops, this glasses. Okay, if it is a problem of the ptosis, cataract, then you have to do the surgery. Okay, so like that of treatment options you have to choose, it depends upon the causative factor. So here amblyopia in children they have asked, so the treatment portion they have asked. So eye patch is there, glasses we will be giving, contact lens will be there. So all of the above will be the answer for the treatment part of amblyopia. Okay, so this is about the amblyopia. This is usually happening in the children. Next, they have asked about some clinical features of folliculitis. So the question was incomplete, so I am just giving you the clinical features. So folliculitis means hair follicle inflammation. It is of two types are there. Superficial inflammation is there and deep inflammation is there. Superficial inflammation means till ostium of follicle you will be getting inflammation. That is called folliculitis. Okay, you can see the picture, like a pimple like structures you can see in the hair follicle, that is folliculitis. Okay, if it is much more deeperly the inflammation is going on, okay, so deeper infection, that is called as furuncle, and another one infection is carbuncle. Okay, so in the deeper structure of the hair follicle infection is spreading, that is called furuncle. Okay, this one hair follicle will be having infection that will be spreading into the next hair follicle. That infectious condition is called carbuncle. Okay, so these are the deep folliculitis, that is called furuncle, and next one is carbuncle. Okay, so here the primary lesion. So in the folliculitis, what are the symptoms you will be getting? The pustule formation. Okay, pus filled pimple like formation will be there, and erythema. Erythema means redness of the skin. So these are the main clinical features of the folliculitis, and the causative organism for getting this inflammation is Staphylococcus aureus. Okay, due to bacteria you can get it. So the main causative bacteria is Staphylococcus aureus is the main reason for getting superficial folliculitis. Due to physical trauma, Okay, if you are rubbing the hair follicles with an unsterilized hand, or with some of the unsterilized instruments you are using, okay, through that way you will be getting a trauma. Through that way you can get folliculitis, or due to the chemical like shampoo, okay, or maybe hair dyes are there, no? So such type of some chemicals if you are using, that is allergic to our body, so that will also will create folliculitis. So these are the causative things for getting folliculitis. Okay, so usually you can see the staphylococcal folliculitis most commonly seen in the children, and mainly it is appearing on the scalp or in the limbs area, and within 7 to 10 days it will become resolved, this condition. So the main symptom is papular or pustular inflammation is happening in the hair follicle. Okay, in furuncle you will be getting an abscess formation. Okay, and carbuncle means a network of furuncles connected by a sinus tract, which means a group of hair follicles will be infected. Usually in folliculitis only one hair follicle will be infected. So carbuncle means the group of the hair follicles will be infected, so you will be getting a severe one abscess formation, like a severe neck swelling you can see. So that much area has become infected. So such type of one deep infection you will be getting, that is called carbuncle. Next they have asked a question, in which vitamin deficiency you can see dementia, diarrhea, dermatitis. Okay, so that is usually seen in the vitamin B3 deficiency. The vitamin B3 is also known as niacin. Next question was, which vitamin is not deficient in celiac disease? Okay, celiac disease means it is a autoimmune disorder which is happening in the small intestine. Okay, because of the intake of gluten content diet, what happen, our body will create an inflammation in the small intestine. Okay, and because of that inflammation, what happen, the proper nutrients will not be absorbed into the body. Okay, so some of the nutrient deficiencies will be there, but among these options, which one you can't see the deficiency? So vitamin B12 deficiency you will be getting, because vitamin B12 is absorbed from the small intestine area. If you are getting inflammation, so vitamin B12 absorption will not be there. Then folic acid deficiency you can get it. Iron deficiency, okay, vitamin B12, folic acid, iron, these are all getting absorbed through the small intestine. Because of the intake of the gluten diet, what happened, the small intestine will get inflamed, and because of that, what happened, it can create this absorption of the digestion of the food will not be happening, so it result in the malabsorption. So celiac disease or celiac sprue means it is a autoimmune disorder against the gluten content diet you are getting. So vitamin D, that much deficiency you can't see. You can get vitamin D deficiency, but not as such vitamin B12, folic acid and iron, because vitamin D is produced from the skin, liver and from the kidney area. Okay, so because of that reason, vitamin D deficiency, that much you can't see in the celiac disease. In case in the option vitamin C is given, because in some of the question paper they have shown vitamin C as an option. If vitamin C option is there, please choose vitamin C as an answer. If vitamin C is not there, then go for the vitamin D. Okay, so accordingly, so see the option, then accordingly you have to choose the answer for this question. Okay, so right now from these options vitamin D is the answer. If in the option vitamin C is there, go for vitamin C. Next question was regarding the clinical features of the psoriasis. So psoriasis usually it is affecting the extensor surface of the body part. Extensor surface means the front of the knee joint, back of the elbow joint. These are the extensor surface. So and then scalp area also you can get the psoriasis. So typically the classical feature means there will be a erythematous skin lesion will be there. Red color skin lesion will be there, and that in the red color skin lesion you will be getting a silver colored scales will be present. Okay, silver color scales will be there. Okay, so that is the typical feature of the psoriasis, and this skin lesion associated with a severe itching sensation will be there. Okay, and along with the skin lesion you can get some lesions in the nail also. Okay, so what are the nail changes you can see? That is, nail pitting will be there, onycholysis will be there, nail ridges will be there. So these are the nail changes you can see in the case of psoriasis. Okay, so onycholysis means there is a separation of the nail plate from the nail bed. That is called as onycholysis. Separation of nail plate from the nail bed, that is called onycholysis. So these are the changes you can see in the nail in case of psoriasis. Okay, so it is an autoimmune disorder. Psoriasis is also an autoimmune disorder. Here inflammation you are getting in the dermis area. Okay, inside the dermis there is some triggering factors, environmental factors, or maybe our diet. Okay, so some triggering factor will be enters into the body. Through that way inflammation is creating inside the skin, and through that way you are getting this psoriatic lesions. Okay, so it will be reddish discoloration with the silver color plaques you can see. That is called as typical feature of the psoriasis, usually seen in the extensor part. Okay, and another one psoriasis is there, that is called guttate psoriasis. So guttate psoriasis actually it is happening because of the after the streptococcal infection. Okay, streptococcal infection means sore throat. Okay, sore throat you will be getting sometimes before fever. So that is called as streptococcal infection. So whatever first if the patient is suffering with a sore throat infection, fever, then after that if you are getting like a small drop like lesions are forming in the our upper back, chest area if you are getting, that is called as guttate psoriasis. Okay, so guttate psoriasis, the main thing is the history of streptococcal infection will be there. Then after that you will be getting skin lesion which is less than 3 centimeter diameter, that is forming in the upper back and in the chest area. So that portions you will be getting like a small drop like lesions are forming, that is called guttate psoriasis. Okay, and this typically psoriasis used to happen in the extensor surface. Sometimes it will happen in the flexural area. Okay, inside the elbow joint, okay, wrist joint. So that type of areas also you can get psoriasis, and then palm, and in the only the palm area you can get psoriasis. So like that of different type of other type psoriasis is also there. Okay, so classically it is happening in the extensor surface. There will be erythematous lesions. Okay, and it will be covered with the silver scales will be there, and severe itching sensation will be getting. Next one is myasthenia gravis. In that, what is the ocular finding you will be getting? Okay, myasthenia gravis means it is an autoimmune disorder. Here autoimmune is happening against the acetylcholine receptor. Okay, so you can see here one picture. From the yellow color is the nervous system, and the another one is the muscles. Okay, so muscles are there. So from the nervous system the impulse will be traveling the dot structures you can see, so that is the acetylcholine. So in that way impulse will be entering into the neuromuscular junction, and then they will be entering into the muscles. Okay, so in the muscles you will be getting acetylcholine receptor is there. Okay, acetylcholine receptor is there. They will be receiving the acetylcholine, and through that way impulse will be entering into the muscles, and through that way muscle contraction, relaxation will be happening. Okay, so first of all here this is the normalcy. So sometimes due to the autoimmune activity you can see there is a Y-shaped structure, so that is called as antibody. Okay, so an antibody will be creating against this acetylcholine receptor. So this antibody will be getting will be there in the acetylcholine receptor, and they are blocking the way. So what happened, this acetylcholine is not entering into the muscles. Okay, because of the antibody production, what happened, the acetylcholine is not entering into the muscles, and because of that what happened, impulse is not transmitting into the muscles. Because of that the proper contraction, relaxation will not be there, muscle weakness will be happening. Okay, so this is called as myasthenia gravis. Okay, so there is an due to the autoimmune activity, acetylcholine receptor antibody is generating, so they will be blocking the pathway of the receptor. Through that way acetylcholine is not entering into the muscles, and through that way weakness of the muscles will be happening. So usually it is, first of all it will be happening the eye region, eye muscles are affecting, so you will be getting diplopia, ptosis. Okay, then weakness of the muscles of the face, throat, generalized weakness, expressionless face also you can see. Okay, that is also present in the myasthenia gravis, expressionless face, limited expressionless face you can see. Then weakness of the jaw muscles, and because of that there will be difficulty in opening the mouth. Dysphonia means a proper sound will not be producing. Okay, because of the muscle weakness due to the autoimmune activity, there is a antibodies creating, so because of that the muscle will not be receiving the impulse, so through that way muscle weakness are getting. Okay, and symptoms worse at the end of the day. So morning time you can do the activities, by the evening time this weakness will be increasing and the patient is unable to do the work. That is also an important symptom for diagnosing the myasthenia gravis. So in the investigation you will be getting acetylcholine receptor antibody will be there, and in the CT chest, because those who are having this myasthenia gravis they can get thymoma, so that's why CT chest can you have to do it, and special tests like repetitive nervous stimulation. So such type of treatment you have to do, investigations you have to do for identifying the myasthenia gravis. So ocular finding in myasthenia gravis is ptosis, diplopia, okay, so drooping eyelid. These are the eye symptoms you will be getting due to the myasthenia gravis. Then sudden loss of vision in one eye. Okay, that they have asked a question. Options I have not got, so I'm just prepared a slide. So what are the reasons for getting sudden painful loss of vision is also there, painless loss of vision is also there. So painful loss of vision, it is happen because of trauma, acute keratitis, acute angle closure glaucoma, acute iridocyclitis. So these are the reasons for getting sudden painful loss of vision. Okay, painless loss of vision is there, so that is happening because of the vitreous hemorrhage. You are getting bleeding in the vitreous humor. Then retinal artery obstruction, central retinal artery obstruction, branch retinal artery obstruction, central retinal vein obstruction, branch retinal vein obstruction. Okay, you are getting a obstruction in the retinal vessel. In that reason you can get sudden loss of vision, that will be painless. Then retinal detachment, which means displacement of the retina, central serous retinopathy, optic neuritis, cortical blindness. So these are the reasons where it leads to the sudden painless loss of vision. Then gradual painless loss of vision is there. So reasons for that is refractive error, pterygium, keratoconus corneal dystrophy, open angle glaucoma, cataract, diabetic retinopathy, retinal dystrophy like retinitis pigmentosa, Stargardt disease, compressive lesions in the brain, age-related macular degeneration. So these are the reasons for getting loss of vision. So study this chart, then accordingly see the question and accordingly you have to answer it. So next question discussion we'll see in the next part.